There are a lot of body changes that can happen when you undergo cancer treatment. Probably the most obvious that people know about is hair loss that can happen with chemotherapy. And planning for that in advance, having some idea of how you want to manage that, is going to be very helpful.
Many of my patients feel very badly when they lose their hair, perhaps while they're getting chemotherapy. And although they know that grows back, it's just a real shock to see themselves looking so different. So there is a whole range of responses based on the actual physical challenge. I think the first and most important thing is to learn to accept the change, perhaps to get some help getting over some of the initial discomfort, and looking at yourself, accepting that, basically trying to love yourself back. And then with time, many of these things get better.
But one of the most profound body changes is actually the tiredness and the fatigue that can go along with all the cancer treatments. And that can be unexpected for a lot of patients. There are lots of things you can do to help with that, but knowing in advance that this might happen and preparing in advance can really help you deal with it the best. There are a lot of body changes that surgery can cause when we're using surgery to treat a cancer. One of the most obvious ones is with a mastectomy, that you lose your breast. Some patients with sarcomas need to have a limb removed. Almost every surgery causes a scar of some kind. Some of those scars are more external and visible, but some of those scars are internal, and that still causes body changes that we have to deal with.
One of the most important things to remember is your doctor is not a mind reader. And it's really important to be clear and frank and open and talk about your concerns. The concerns can be emotional, but they can very well be physical as well. So if you feel that as a result of the cancer or cancer treatment, you're not functioning well, either because you're not sleeping well, you can't remember things, you can't walk very well, or you feel that you are troubled by the way your body looks or moves, it's important to talk to your doctor. It's very likely that there is somebody on the team or somebody in your community who can actually help, who can listen, give you a program, and help you get better and achieve the best possible function.
My recommendations for how to deal with the body changes are, first of all, ask questions in advance and understand what body changes are possible or probable as you go through your treatment. Ask maybe if it's helpful to talk with others who have gone through this before you. Maybe a therapist or someone to help you deal with the loss, the grieving that can go along with some of these body changes that are more permanent could be helpful. So thinking in advance about how you want to share your story, who you want to tell, what you want to say is going to be helpful, because people will stop you if they see some visible scars or hair loss or some obvious signs that you're undergoing cancer treatment. Usually they have a good heart. You know, they're thinking about you, they want to try to help, but sometimes it's just not a good time and place to talk about it. So having some key words or just feeling comfortable saying, this is private for me right now, I'd prefer not to talk about it. Just kind of thinking of that in advance can be really helpful so that you're strong and you know what to say when people approach you.
You don't have to do this alone, that there are many professionals and many services there to help with either rehabilitation for a body part that's not working so well, recovery of function after you've become perhaps out of shape or deconditioned as a result of your cancer treatment, or perhaps learning to live with a side effect that you didn't anticipate, perhaps pain in your legs or the loss of a sense of balance. So whether it's small or big, whatever happened as a result of having had cancer or cancer treatment can be helped. And I think it's important to have the right referral to either a physical therapist or a rehabilitation program that will help you overcome those problems and get you to function as well as you possibly can.